ministries because this is one of the cross-cutting issues. We need to involve the Ministry of Housing because we talk about the shelter, right? When the workers are, state vendor, they go for livelihood in terms of the, amplifying area, probably in a heat sourcing of around 47 or 49, we need to have some special retrofitting in those localities. So these are the critical areas we need to be really deep down into the planning process. Again, ma'am has also highlighted very important aspect of the early morning, right? We know temperature when rises, there are critical agencies like, there are government agencies like INT or there are different player also who gives early warning. So how this information is going to that particular section of the vulnerable community, that's again one important area. Looking at the, probably all of us know their weather pattern, right? We go into the apps, we can know the next 7 days weather forecast from, January. So how this message is transmitted to the community level, right? So this the another area probably we can look into those perspectives, probably organizations like us. We are also disseminating in the different, communications through different channels, but we need a lot of engagement with the civil organization. So this is the critical area we need to be really involved in terms of the coordinations, giving the, seasonal and the monthly early warning mechanisms to those particular segments of society. Now coming into structural and spiritual studies, we have initiated a full loop initiative. That's one of the agenda of being getting all the metropolitan city, including Sinai, has a very demonstrated pilot project which has been initiated by one of the event organizations like UNA. So I request all of you to just go to the Sinai interventions in terms of the pool of strategy. This is one of the best models. We are also trying to replicate, one of the best models to across other states of India, which is having the similar problem. So I think that's one of the interventions probably we need to be carried forward. Of course, public awareness, we already know that how the, current day interventions in terms of the message goes through different channels, right? We have the messaging system, right? So, like in NDMA, we have the common protocol. That's one of the messages, when disasters are going to happen in somewhere in terms of the early warning, we disseminate to large scale of messaging. So these interventions probably also be grouped into the heat action plan. If something in that scenario, probably how care will be utilized in those scenarios. So these are the some of the public awareness. Maybe some of the local social media also plays a crucial role in terms of the awareness on those scenarios. Of course, the informal sector, like we are talking about a state member. So how this sector, in terms of a specific guideline, can be developed, both at a national level or maybe in a very crucial, like there are other ministries. So we need to be at the SOP, right? We need to be a very specific guideline to reduce that sort of an impact to the especially the street vendors. So this is the area I probably because you have been working very closely with those scenarios, right? We need to build up those, learning and need to have a very comprehensive SOP. So this guideline, of course, when we make a district level, micro planning in terms of the heat action plan, there are certain guidelines. But again, in terms of the disseminations, that need to be, looked around to that particular vulnerable section. So again, this is one of the greater area we are looking into in terms of the policy level decisions. And of course, this very critical sector in terms of the medical preparedness. Of course, when heat at the level of 48 or maybe around that scale, so there are a lot of health hazard, right? So what is the initial actions can be done with the support from the public health emergencies, right? Well, of course, like district, like director of health services, at national level we have the ministry. So the ministries are doing well, but again, we need to have a very comprehensive action plan. That again, it has to be localized effort. So I think that the medical preparedness is one of the greater area. At NDMA level, we are looking at a very comprehensive, inclusive plan preparations in terms of the national action plan. Now coming into very specific research study, I just wanted to give you some of the important aspect of this issue. There's an institution called Postman Research Institute, and there's an Indian agency, Center for Social and Economic Progress (CSFP). I think they are doing a tremendous job in terms of the looking at the double trans of the heat action. India is